Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning, and welcome to Ethical Perspectives on the News. I am your moderator, Karl Cassell. The question has arrived on whether the United States can minimize or eliminate a virus that has become a global public health menace, but also maintain its commitment to preserving and upholding constitutional law for each and every citizen. There are many who believe that getting the vaccine is a prerequisite for each citizen in the preservation of the health of others, while others are very vocal about their right to bodily integrity. In our time today, we want to discuss both of these perspectives and everything in between. Joining us for this discussion today on vaccine mandates, we have David Osterberg, Emeritus Professor of Public Health at the University of Iowa. Good morning.
Hi there.
And Mike Owen, Deputy Director of Common Good Iowa. Good morning.
Good morning.
So let's just start out by maybe you guys discussing the challenges from a public health perspective, but also from a citizen's rights perspective. Let's start out with the public health perspective. What are some of the concerns and the things that you see we need to be cognizant of as a community, as a population of people?
Well, let me start, since I taught for a number of years at the University of Iowa in public health. And there's not a lot of question that we are in the job, we, government writ larger, are in the job of protecting people. I'm happy we have police. I'm happy we have an army. I'm happy we have a public health service that tries to make sure that folks are protected. And that's what a public health perspective is. And, we can even talk about a code of ethics, and the American Public Health Association has that. And included in that code of ethics is something on human rights and civil liberties. And coercive legal measures that limit people's behavior is not the first choice. You'd only move to that when other things aren't working, like now. So as far as a public health perspective, you need to protect people, and you especially need to protect the vulnerable, children, the elderly, and nursing homes. And we can talk about each of those, but an article that came out this week in the Cedar Rapids Gazette talked about what we have a nursing home. The state runs a single nursing home, and that is a veterans home. And in that veterans home, we have the most COVID-19 outbreaks of any nursing home in the state. It went from last week, it was 2 weeks ago, it was 37, it jumped to 64. We know that people in nursing homes are vulnerable. Of the nearly 7,000 people in Iowa who have died from COVID-19, about 2,500 of them were in nursing homes. Not requiring people who work there to protect their citizens that they're in charge of, I think, is wrong. This is a public health issue. Those people should be vaccinated, period. We can look at other issues, but that one seems to be very clear.
Well, I would, at Common Good Iowa, and I want to make it clear to everybody, David and I work together at Common Good Iowa. We look at issues from a public policy perspective. And so we try to see where public policy makes sense to play a role in our lives. And this situation with COVID probably the greatest public health threat that any of us has seen in our lives, probably anybody watching this program. You'd have to go back to World War I and the outbreak of what was then called the Spanish flu, the pandemic of that era, to see something comparable. We are experiencing this now, and this is a tremendous opportunity for us to use public policy to combat this tremendous health threat. And I think that, maybe in this show, we can get into some of the issues that have arisen over the last year and a half, as we have seen both our state and federal officials try to deal with it. But I think that some of the questions that you raised at the outset, Karl, are appropriate, and they should be discussed in many public forums, not the least of which is the Iowa legislature, which has really not permitted a very comprehensive and accessible forum for that discussion to be had.
Yeah, thank you. So, but let's get into some of our state and our federal government perspectives. What has been done well, starting maybe from the federal level here federally and in our state, and what hasn't went well, and what would you like to see done differently?
Well, first of all, we have to say that very powerful vaccines were started and came about very early, and we have to thank the Trump administration for that. It was a good way of getting things going, and it did. And I think that badly done, of course, was the denying that it was going to be a very big problem, and then going on to talk about miracle cures and other kinds of things that were done badly. But as far as the vaccine, those are good vaccines, and they were really well developed. State level, I think we've been in this kind of denial where you try to stop things from happening. You stop people at a school board from choosing to have a mask mandate. That is not at all protective of those kids. And then there are rumors that somehow our governor is going to push back on a mandate to have vaccination at large companies. That certainly is not going to help the virus kill fewer people. It's going to do the opposite. It's pro-virus.
Well, let's just start by looking at some of the data to determine how well things have gone. And I think we really focus at our organization on what's happening in the state of Iowa. And in Iowa, we've had over about 515,000 positive tests for COVID since this started. And in that year and a half or so, we have seen, as of latest count from the state, 6,848 people, as of the count last week, who have died of this virus. Now, none of us knows how things would be different with different policies that would have been in place. But it is undeniable that the Reynolds administration has severely cut back on the kinds of restrictions that science tells us could be effective in stemming this virus, this pandemic, from causing the kind of destruction that it has. I mean, I think it is a fair question to wonder. We can't answer it, but it is a fair question to wonder how many of those over 6,800 people in Iowa would be here today if we had taken a stronger public policy position to fight this virus, this tremendous threat. when we not only the legislature and the governor, and the legislature, by the way, bipartisan, voted against having so-called vaccine passports, requiring that people would have to show vaccine, that they'd gotten a vaccine in a business or at an event or in various ways. I don't understand it. I understand the philosophical arguments, but this is something that clearly works. Now, our governor has made a big point over the many months of this to say that she opposes mandates and requirements and so forth because Iowans will do the right thing. Clearly, many Iowans are doing the right thing, but also just as clearly, many Iowans are not doing the right thing. And what do we do in that event? What kinds of tools can we use? One of them certainly is requiring vaccines and showing where you work or where you attend an event where other members of the public are there that you have been vaccinated. One of them is requiring masks so that you do things that stop the spread of the virus. It's not an opinion that these things work or don't work. They work. Science has shown this over just this matter of months. And our public policy can be shaped to make that happen.
Thank you. So let's take those perspectives of the mandating vaccines and potentially having people show, whether it be a digital and or a hard copy of a vaccination card. What sort of issues would that cause, or separation in society, and potential issues could that cause if we start separating people according to vaccinations?
Well, I'd like to take this just to start out. I was fortunate enough within the last month to take a trip to France and Italy, where they have these vaccine mandates in place, and they require people going into a restaurant or a business or a museum to wear a mask. These are not problems. People deal with it very easily, and it's not a question of separating people in public. This is what brings people together. To have these requirements in place is something that actually does not separate people. It brings them together. The alternative is not having these things and people staying home because they're afraid to go out where people are putting them in danger. It's not a problem. You go to a restaurant, you show your vaccine evidence, and you walk right in, and it works just fine. In fact, I found it very interesting. In Italy, they honor the United States CDC pass, or the card that you get when you get your 2 shots, and you get the card with the CDC logo on it. They honor that in Italy.
David, you want to add anything?
No, and again, the separation, Karl. When faced with something like this, I kind of try to say, well, what's this like? I think mandating that you have to have proof is kind of like a driver's license. You may be a very good driver, and you may think you're a very good driver, but in Iowa, we don't let you out on the road unless you have a card that says, I am legally able to drive, and I've had an eye test within the last 4 years, and I've at one time passed some exam that says I know that I'm not supposed to run over people in crosswalks, that sort of thing. That doesn't seem like a big imposition that separates people somehow. I think it says anybody who can do this ought to be a driver. And we still have all kinds of fatal accidents and other kinds of injuries. But the point is, if you don't want to do that, you can choose not to drive.
So let's really deal with the mandates specifically. So government telling people or telling companies, federal employees and or anyone with government contracts, your employees need to be vaccinated or else. Again, is this a forced compliance, and are we threatening the livelihood of our citizens by telling them either you take something that you're uncomfortable with putting in your body for somebody else? Is it forced compliance? And can we constitutionally, even though there are court rulings over the last 120 years that give people bodily integrity, are we constitutionally wading in some murky waters?
Well, again, as I tried to say in this code of ethics that the American Public Health Association has, this is not the first choice. You do it when other things aren't working, and they aren't working. And so whether or not I'm threatening somebody's livelihood, only if I refuse to protect my fellow workers. And, the mandate that comes from the federal government is one thing. But remember, there are a lot of companies that mandated on their own. Well, Delta did it in a very interesting way. Delta Airlines. They said, we can show you that people who aren't vaccinated are going to cost our health insurance a whole lot more than people who are. Therefore, you pay for that extra amount. You pay $200 a month towards your health insurance that we give you as a company. And then you can choose. And the percentages are way high in the 90s. So most people, given that choice, will say, fine. United Airlines went the other direction, and they said, our pilots can't fly into, say, Iceland unless they're vaccinated. That's Icelandic law. Therefore, we cannot make sure that our planes have pilots to fly. Therefore, we mandate that everybody has them. They have 67,000 employees. 2,000 have asked for some kind of an exemption, a religious exemption or a health exemption. And I have no idea how many of those are going to be honored. Certainly, if you can't get the vaccine for some reason, health-wise, you're not going to get it. But besides that, there are 600 people who said, I'm not participating. I'm leaving. That's 600 out of 67,000, or 6 out of 670. That's a small number of people. And what are we doing is endangering everybody else so that this 1% is somehow happy and feels bodily integrity. I think that we're all part of a society, and we all have to be part of that society. And that means protecting one another.
Yeah, I think it's important to recognize that I think there are some people that are treating this like it's a new thing. It's not new at all. We have state laws that require immunizations for children in schools or in care centers to have various immunizations for diphtheria, for pertussis, tetanus, rubella. There's various requirements in state law right now. And there are ways that you can get exemptions from that. And certainly even in the rules that the Biden administration has put out regarding the federal mandate, so that businesses of over, I think it's 100 employees would be subject to this. There's different ways that people can get exemptions on this. They're working on those things through the rules that is being set up. So it's not a new thing. We've dealt with this before, and it just seems odd that in this particular pandemic, which is just killing so many Iowans and so many Americans, that we would be rebelling at that. It's just not logical.
Karl, here's again, maybe it's the way I think, but I'm trying to compare this to other stuff. Companies have the right to say, you don't come to work unless you do the following things. If there's no labor union, they have that right. If there's a labor union, the union's got to say, wait a minute, this has to be bargained for. And remember when the start of the pandemic happened, it was meatpacking plants where the outbreaks were. And it's a kind of job where you're right next to one another. And Tyson's Foods in Waterloo had to close down because they couldn't get any workers to come. There were too many sick people because of their policies. Now, Tyson Foods, which is mainly unionized, 80% of their workers are unionized, were put out a mandate. This is what we want. The unions then said, what are we going to get? And what they got was sick leave time for the first time that this company gave people sick leave, paid sick leave. And that's how the bargaining went. And that's fine. But also companies without a union can say all kinds of things. Think about drug testing. If you are driving one of these heisters around in a warehouse someplace, nobody wants that person to be high. Therefore, having the ability to say, you may choose that you're happier if you're high, but then don't come to work. You can't work at our establishment. This doesn't seem to cause any ethical dilemma in the minds of most people. I would push back on those kind of mandates if it had nothing to do with safety. I don't care if people aren't going to endanger other people, but if they are, there's a right for a company to say that. Whether they're mandated to do it or not, they can say it.
So we have the rollout of now the boosters after the vaccine. How long should we, into the future, require people to keep getting vaccinated or keep getting booster shots? And then the other part of my question is the financial piece that you mentioned, speaking of the airlines. So financially, even if 600 here or 1,000 here or even 10 or 20 here from this company, it's going to put their families and our neighborhoods at financial risk if people no longer can pay their bills, because now no employer will hire folks who are unvaccinated. What could be the ramifications of people losing their jobs, potentially their home because they've lost their livelihood, but also how long will we continue to force people to get booster shots to maintain employment?
We have to let the data tell us that. I mean, if you were to have a continued spread of the pandemic, you should address that as it goes. But I think that a lot of people pushing for vaccine mandates and some of the other requirements are looking at this as a way to get us quicker to an end so that we are back to a more normal situation. Just people dragging their feet on getting the vaccines is making that go longer. In Iowa, a lot of the working age population, about more than 4 in 10 are not getting the vaccine. And so those working age people not getting the vaccine. We know the vaccine works. Vaccine requirements, whether put in place by businesses, which the governor doesn't want to happen, doesn't want even businesses to put those in place, or put in place by government. Those kinds of things can stem the spread of this pandemic in that population.
Anything?
Yeah, again, I'd say the same thing Mike said on, I don't know. We don't know how long this is going to last, but it's going to last less if more people are protected with masks, protected with vaccines, protected by, not being right next to one another where this virus passes from one human to another. We don't know that. We can't know that, I think.
So we have just a couple minutes left, and so you brought up medical or religious exemptions. Should these be challenged in this public health scenario, or eliminated altogether?
Well, I'd say that that's certainly a that's one of the exemptions, and you ought to look at that. I mean, if somebody says, well, Jesus never got vaccinated, so I'm not going to either. I mean, that doesn't seem like a good religious exemption. There are others that make some sense. You can show that historically, this is what your church or mosque or synagogue or whatever accepts. And I think that sometimes you can try that. And sometimes if you try it, and fail, you do lose your job. I went to Washington State University. They just fired their football coach because he refused to get a vaccine, and he tried in a religious exemption that they decided was bogus. Yeah, I don't know who's going to challenge that, but there always ought to be exceptions. There are circumstances, but in general, we're going to win this fight against the virus when more people are protected.
So
and that's why we have courts.
About a minute left. I want to first thank both of you for such a robust and enlightening dialogue on the topic of vaccine mandates. The hope of a nation lies in the fact that we as citizens believe that the public health of all is important, but we also want to remain the land of the free and home of the brave. Can there be compromise on how we get there? Well, the answer will be made clear in the near future, and we encourage each and every one of you to participate. Thank you, and have a great day.
Thank you.
Thank you.
Thank you.